You've probably heard the term panic attack before. However, do you really know what panic attacks are all about? Well, on this week's episode of GetPsyched, we're going to be taking a look at what exactly panic attacks are and how we can best treat them. Guys, welcome to another week's episode of GetPsyched, and like I said, this week we're going to be taking a look at panic attacks. And first things first is we need to ask the question of what exactly is a panic attack? Well, there are a few misconceptions about what panic attacks are. One of the main ones is that it's just anxiety. Whereas the truth about panic attacks is that it's actually an explosion of fear. Rather than being anxious about something, feeling under threat for your life is kind of one of the foundational principles of what is underlying a panic attack. People can experience physical reactions from experiencing panic attacks as well. And as a result, sometimes panic attacks actually go unnoticed. Sometimes they're fobbed off as just periods of ill health, or even dangerous reactions to things. Understanding that panic attacks can be misconstrued as physical ill health actually shows how profound a panic attack can be. It's not uncommon for people to feel violently sick or have really terrible headaches when actually it's attributed to some form of panic attack. Now, panic attacks normally last around 10 minutes and actually peak as they get closer to the end. And they often happen, it's not uncommon, for them to begin or for somebody to experience a panic attack when there's no evident stimulus that's actually caused that panic attack in the first place. Someone sitting on their own can actually start just having a panic attack from what seems out of nowhere. Now, one of the key things I want to get across in this video is to understand a little bit of the difference between anxiety and panic attacks. As I said just a minute ago, one of the misconceptions about panic attacks is that it's often just thought of as anxiety. In truth, anxiety is when we feel that something might happen. Panic attacks are attributed to when we feel that something really terrible is happening right now. And when people experience panic attacks, sometimes they feel that they're losing all control, and even sometimes they feel like they're dying. So panic attacks can be really dangerous, and they can be really detrimental for people. Now, due to this surge in fear, the brain reacts and kicks in a defense mechanism. And these are based on the brain's attempt to either try and figure out, run away, or attack. We commonly know this as fight, flight, or freeze. And this process results in some of the common symptoms that we actually see from panic attacks. These include increased heart rate, shaking and sweating, extreme shortness of breath and chest pains, nausea, and many more dependent on the individual. It's no wonder that panic attacks can be so severe when we weigh up all these different symptoms and the element of extreme fear that somebody experiences when they have a panic attack. There's something else that we need to understand a little bit about panic attacks is that there are different types of panic attacks, and these come under two different headings. They are situational and unexpected. And they're very much as they sound. Situational panic attacks are when a panic attack is instigated by a certain situational stimuli. For example, that could be the fear of public speaking or about to go into an exam hall to sit an exam. It could even be stresses at work. Giving you a little bit of my own understanding, I've never actually experienced a panic attack myself, but I have had a client in a session that I've been conducting experience a panic attack in the therapy that we've been doing. Now, some of the things that we were discussing in therapy actually led to that panic attack. It probably was a situational panic attack that my client experienced. Now, when this is the case, removing yourself sometimes can be seen as a good intervention to help with situational panic attacks. However, the research says that this can actually increase the harm of the long-term effects of these situational panic attacks. Rather than facing the fears and realizing that the situation is not as terrible as we first perceive, can actually mean greater detriment and mean that those situational panic attacks can increase in the long run. We never give ourselves the opportunity to realize that our fears are irrational. And that is one of the keys to treating panic attacks. During a panic attack, we feel that the fear, this explosion of fear, as I said earlier, is a real fear and that something terrible is happening right now. If we can help people and get ourselves, if we experience a panic attack ourselves, to a position of realizing that these fears are irrational and that we aren't going to die and that something terrible isn't happening, then that can help with the process of panic attacks. But if we constantly remove people or remove ourselves from the situations that are causing that huge panic, then as a result, those panic attacks can get worse in the long run. The other type of panic attack, as I've said, is unexpected panic attacks. Now, these are a little bit different. And although it sounds like a panic attack maybe just comes out of nowhere, that's not necessarily true with unexpected panic attacks. They are driven by a fear or sensation that is misinterpreted by the individual. Now, one of the things that can actually lead to unexpected panic attacks is that people can start to develop an irrational fear that they are going to continuously experience panic attacks. For example, they might feel their heart racing, they might feel a little short of breath, they might even feel a chest pain, for example, and automatically associate that to them having another panic attack. And as a result, a feedback loop occurs. So your heart might start racing, you might start worrying that this is the beginning of a panic attack, and as you've done that, your heart rate increases even more, and then the likelihood is that you may actually experience a panic attack. I think as we explain the process of people that experience situational and unexpected panic attacks, it can be easy to think that, oh, we just need to change people's minds, or you just need to stop thinking about it, or don't get so worried. Now, that's not the case at all. Like I said, these fears are genuine fears. People genuinely feel that sometimes their life is even under threat. But if we can work with individuals, if we can start to experience ourselves that our fears are irrational, that we're not about to die, that something terrible isn't happening right now, then we can start to alleviate that process of panic attacks. So how else can we treat panic attacks? Now, of course, therapy can be really beneficial for panic attacks. CBT and person-centered therapy has been shown time and time again to be really beneficial from those that experience panic attacks. And again, part of the object of therapy with regards to treating panic attacks is to helping individuals experience that their fear is irrational, that it's not real fear. And as a result, hopefully those panic attacks can dissipate for the individual. Okay guys, thanks again for watching this week's episode of GetPsyched. This week we've been taking a look at panic attacks. We've been looking exactly about what panic attack is all about, what happens to people when they experience panic attacks, and how we can actually treat panic attacks. If you've been enjoying GetPsyched, guys, then make sure to hit that subscribe button. You can hit that little bell next to the subscribe button and you'll get weekly reminders every time I upload. Thanks again for watching, guys, and hopefully catch you next week.